Welcome to CareHero podcast, where our mission is to educate, motivate, and inspire nurses and other healthcare professionals. In each episode, we explore how our guests successfully advance their careers and improve the lives of their patients and residents. We share practical tips and success stories to illustrate how you, our care heroes, can grow in your own personal and professional lives.
Hey there, Care Heroes. Thanks for tuning in to another episode of CareHero Podcast. I'm your host, Martin Hoy.
And I'm Gerard Hernandez. We're delighted to introduce you all to our special guest joining us for today's CareHero Podcast episode.
Yes, today we have Dr. Rosemary Xavier, an assistant professor at the University of North Carolina at Chapel Hill School of Nursing and the research lead at XLab.
Yes, that's right. She's a research scientist and a psychiatric nurse practitioner who investigates the biological mechanisms of neuropsychiatric symptoms for clinical translation.
And Dr. Xavier has a fantastic story and excellent life lessons to share, including the significance of loving what you do, to remember that it's okay if you don't know everything, to always stay thirsty for knowledge, and the importance of believing in yourself and trusting in your abilities.
Sounds awesome, Martin. Let's go.
Welcome to the show, Dr. Xavier.
Oh, I'm happy to be here.
We always start off our show with this question. All of our care heroes, including yourself, are superheroes. But if you had to choose one superpower, what would that be and why?
When I work with patients, as you know, my specialty is in psychiatric mental health, and I work with really severely ill patients. And most of them have psychosis and, a type of schizophrenia or, something that is severely debilitating. So I always wish that I knew the right thing to say, or, just maybe with a look that I could make their suffering a little bit better. So put people at ease. I think if I ever wished I wanted to have a superpower, it would be that.
Perfect thing to say at the perfect time. Is that right?
Sometimes conversations or words doesn't do it. So it's mostly anything. It could be a word, it could be just a look, or it could be a touch, or the thing to say that would actually bring the suffering down to a manageable level, or the pain down to a manageable level, or give hope, to a level where they can actually use it to make the life better.
That's such a wonderful and heartwarming superpower. I love it.
Dr. Xavier, you've got a decade of experience as a research scientist and a psychiatric nurse practitioner. Can you tell us a little bit more about your life story, background, and how you got into healthcare?
I was actually born and raised in India, and I was actually raised in a rural fishing town. And I always share the story because this actually conveys where all this started, my interest in working with patients with severe mental illness. So I remember, I probably was in kindergarten, so somewhere around 5 or 6 years old. And I used to walk to school. So it's very normal for us to walk, maybe about a mile, one way. So I used to walk by a bus station. And I used to see a man, the striking thing about this man was that he had very shiny eyes. I mean, I don't mean in the superhero movies or so, but he had very sparkling eyes. But he used to be dressed in layers of clothes, and it's unusual. India is very hot, right? Hot and humid. I mean, I used to wonder why this guy was always in so many clothes. But one day I saw that he was bleeding from his hands and from his feet. Later, I find out that he was actually bit by a stray dog. And I was very young, so I was only 5 or 6 years old, but I still remember this so clearly. And my uncle's response was, ayal ka prandan, which means that he's sick in the head. And my next question was, if he was sick in the head, why was he not in the hospital? And the response I got was, you're a girl, you're not supposed to ask questions. So, keep quiet. And something that, it kind of stuck with me. And so several years later, as a clinical nurse, I was working with patients with severe schizophrenia, bipolar psychosis, and these were patients within the state hospital system or patients who were, brought to the hospital by the police or emergency services. The same thing, I saw the same pattern. So turns out that patients with schizophrenia or psychosis, roughly 80% of these patients have this thing called impaired insight, which means that they are not aware that they are sick. and they don't understand the consequences of their illness. So that was actually the start.
Wow, such a powerful story there. Kind of one of those, were you born into healthcare or healthcare found you when you were 5? I mean, and then now that kind of story, I mean, you're inspiring even little girls out there, I'm sure, that you've encountered through your career arc and now in behavioral health. And of course, now we're going to jump into your assistant professor role, but such a fantastic story, how you got here. Thank you for sharing that.
It's interesting when somebody challenges you and says, hey, you're a girl, don't ask questions. Well, you've certainly been asking questions for your entire career. Currently you're the assistant professor at the University of North Carolina at Chapel Hill School of Nursing and the research lead at XLab. So could you tell us a little about these roles and what you do in each of them?
So I'm relatively new to the position. It's a tenure track position. What it means that my primarily role is research. There's also teaching involved. I don't carry a clinical practice right now because the position entails a lot of work to move ahead. So I'm focusing primarily on research, and I have very little teaching responsibilities. XLab is my lab, basically. So within nursing, it's unusual to have a research lab. So I did my PhD at Duke, and so my PhD is in nursing, but it's focused on psychiatric genetics. The reason is because I don't think we can actually use a discipline-specific approach to understand, or to help people. Because one of the things that I realized when I worked as an NP was that when patients come in, or families come to us, they're not asking, telling us to do, you are a nurse or you are a physician, you use your physician identity to help us. And at this point, we need to actually combine. It's a complex problem. We need to combine the knowledge or the expertise we have from different disciplines to do that. So my mentors were from nursing, from psychiatry, genetics, and also my training involved methods that we use in cognitive neuroscience, as well as I had some molecular genetics training at the NIH. So after that, I realized that I needed a much more stronger training in neuropsychiatry because nurses with advanced training, especially in research, are very few. So I was very fortunate to get a postdoctoral fellowship at University of Pennsylvania. And I knew, when I was doing my PhD, I want to have a lab. I want to train people. I want to actually give the opportunity to folks like me from 10 years ago, or but even I was younger. You need to know that things are possible. There are ways that you can, start addressing a problem. There are skills that you can learn. Number 2, you need to know people who can actually help you network with other people. There are times when I've had to take the long route to get to where I am. So I thought and I'm also a first generation, high school and college graduate. And so it's I've had the lived experience, and I wanted to make, I guess, a little bit more fair to the people who are coming after me.
That's great. And, I totally understand the fair and equitable comment you made. As I was an undergrad looking to get some lab experience as a microbiology major, we had to find the right labs and get a position at those labs. And it's tough as someone who has no connections to that world. But also, just how do you think your bedside nursing experience helped you in your next career as a research scientist?
The questions that I ask, I think, are informed by my, clinical experiences, right? Just to add something, someone said that you can see child geniuses in math and, some of the, the quantitative sciences, but you don't see child literary geniuses. There isn't an 8-year-old who can write, epics or something like that. The same goes with statistics. So math, you can be a math genius as a child, but statistics also takes that kind of experience to understand or make sense of what we call as uncertainty. I think the same applies to some of the nursing problems too. The questions that we ask actually are informed by our clinical experiences. So I used to work as an ECT nurse, which is ECT is electroconvulsive therapy. This is a treatment that is for major depression. So very severe depression, patient who don't respond to conventional treatments like medications or, inpatient treatment, and they fail pretty much everything else. And, for some patients, ECT works really well. When I was working as an NP, I had a patient who come in And patients with schizophrenia often have delusions or hallucinations. Now, hallucinations are things that, patients hear that or see that they are not there. Delusions are like false beliefs. So there are patients who would think that they are somebody else or in a position of power, or they have something else. So this was a young guy who came into my clinic. He had just been, discharged from a big hospital, and he told me he had a PhD in biochemistry or something like that. And I didn't believe him because I thought he was just saying that. And, to double check, I went back and checked again, and I felt guilty because I didn't believe this patient. Now, there are two things here. One is there are situations where patients believe things that are not true, but there are situations when things are true, but providers like me didn't believe him, right? Him or her. These experiences, I think, shaped my research journey, I think.
Yeah, it's like empathizing with your patient and understanding sort of the situation that they're in and being open to interpreting your experiences differently in a way that's more patient-centric.
It's just about having that open-mindedness, right? I mean, every experience we have, what we do is we have to give the person the benefit of the doubt and also keep an open eye towards, the things that are happening in the interaction that we have with the patient, as well as any chance, that we get to know that person better for whatever it's worth. That relationship piece is really, really important. And even in therapy, we know that it's not the kind of therapy, the psychotherapy, that actually makes the person better. It's actually the relationship that the person has with your therapist. So I think that relationship piece is really, really important.
Well, that's just wonderful to hear how you've leveraged your clinical and bedside experience to your research work. So now in leading research at the X Lab, your lab, what do you most love about that role?
I love that I get the opportunity to do something that I love so much every day, which is when you get the data, you've asked a question, you get to actually answer that question. And that piece of information, only you know that. And then you have to make sure that you are disseminating it. That, I just love that I get to do that on a daily basis. It's like I'm unlocking the secrets of the brain and, the person and, whatever you want to call it. I know that's a little bit like fantasy, but I truly get elated when I do, find something. The second thing is I have a lot of super brilliant trainees. Now they add a richness to my lab. They ask challenging questions, they keep me on my feet, they do so much too, to answer some of the questions that we are really working. So it's like a collection of really brilliant minds that we can use their, brilliance to kind of answer some of the questions that are clinically relevant. And, when I say these trainees come from different departments, so which includes like statistics and, biology and, math. And so it's just seemingly unrelated disciplines, but your skills are so valuable, I think, in helping us answer some of the problems that we are studying.
Mm-hmm. And so the discovery, but also you're getting gratification from sharing it, whether it's your trainees or sharing it with a broader audience. That's wonderful.
Dr. Xavier, could you describe one of your most exciting days at work for our listeners?
One day. An exciting day for me would be if I could just go in and start working through the data, part of which would be as I said, trying to answer some of the questions by applying some of the methods that we've developed in the lab or, that exist in the field. Then we do have lab meetings. We also talk about how to balance life and work. So if there is a personal, some problem that someone wants to share, then we talk about that so that we are also serving as a support group. We also have prospective studies. That means we have patients sometimes coming into our lab. So it's always good to kind of interact with our patient, population. And what I found is patients are very interested, in knowing what's going on with them. And so when we reach out to them, they want to know, even if it's genetics or something else. So probably this is what I would call an exciting day. Maybe not, exciting to other folks.
Dr. Xavier, when you're on the cutting edge of discovery like you and your team are, I can understand how, moving along, getting things done can be so enriching for you and your team.
We know real life is not like a TV show where you're going to solve everything in half an hour, right? So what is your biggest challenges then working at the lab and doing your research, if you can let us know? And how'd you overcome that?
Well, I think the challenges are different on a day by day. Most of it is, as I said, we are an interdisciplinary lab and we have a lot of folks from different disciplines. It's like sometimes it takes a while for everybody to be on the same page, to understand the problems the same way as we do. Folks who use math or stats, to answer a problem, see things in a particular way. The challenge is up, it's usually in the beginning, everybody has to be on the same page, everybody has to understand what we are trying to do, and just getting everybody to speak the same language, because what I use in clinical nursing might be very different from someone who uses that same term in math or in stats. So that can be challenging, but it's also quite rewarding when everybody fully understands. So it usually happens towards the end of the project, while we are doing. It's like, oh, now it makes sense. And, I'm so glad that you were on board because you helped me understand. The second is in research, and I'm sure every researcher will tell you the funding situation can be difficult. So especially it's hard for junior folks to get funding at a stable level to run the lab. We do need a lot more funding to help people. So that is always challenging too.
Do you have any advice for individuals who could be in a similar situation regarding funding?
Well, since I'm also at the starting stages of my research career, what I do find helpful is having mentors who can actually support you, because you do need someone who has actually done this before and who knows the ins and outs of agencies or funding agencies, like what they're looking for. So you need to have good mentors. And often when we say mentors, we think it's like a one-to-one relationship where one mentee has one mentor. It isn't like that. You need to have a group, mentoring team to kind of support you in all aspects. Now, funding is a practical resource. So it's a resource to help you achieve, your goal. So it has to go hand in hand, right? So you need to be able to get the funding, but you also need to be able to complete the project and make sure you're making use of it and you're achieving your ultimate goal, not the narrow goal that you have for the funding. Find people who can support you, find people who can actually, and this applies to even for someone who's actually thinking about starting a research career. Mentorship is still mostly in the apprenticeship model, but we need to go beyond that.
So, Dr. Xavier, if you're a nurse that's currently looking to explore a career in academia, what are the first three things that come to mind that you could tell them that they should do to learn more about it? Because they may not know what research topic they'd like to pursue, but they want to better use that part of their brain or that experience.
Yes. So the first thing is reach out to someone who is doing the type of research that you want to do. I know most academic faculty, they like receiving emails from people who are interested in studying that. So just email them, just have a casual conversation with them, ask their experience, like what it was like for them, discuss your interest and see if that is something that they can help with. Or if they are not the right person, they will actually make suggestions, for who can actually work with you so that you can pursue that research problem that you're interested in. The second thing is there are clinical nurses. You don't have to be a bedside nurse. There are research clinical nurses, right? So you are part of a research protocol. So if that, look out for something, try to get involved in that kind of project as a research nurse, because nursing is actually also a specialized skill. Like how do you collect consent so that you can actually get some experience that way. The third thing is read papers that are being published. So for example, if you are a psychiatric mental health nurse, there are journals, the Journal of the American Psychiatric Nurses Association, or, there are journals which publish cutting edge research on what's going on. So read, and then you can find people, like researchers who are working on your problem of interest.
That's great. Yeah, just like many other industries, you go talk to the people that are in the role and learn more about it directly from them. Get involved in any ancillary or related fields, and then make sure you do your research. Read the stuff that is relevant. So that's all fantastic, and appreciate you sharing that with us. So, Dr. Xavier, how do you continue to learn in your role to stay on top of things? I know things change all the time, and you're at the leading edge of what you do.
With the amount of papers that are coming out, that's always a challenge, but it cannot be without reading or keeping myself updated. I have to read because reading actually helps me decide my future studies, helps projects or that are being published by my colleagues and researchers in the world inform my research. So one of the things I do is subscribe to NIH, PubMed, do a keyword search and then subscribe to, so you get all the publications. The second is we have seminars and professional society conferences. So you are hearing from them what the latest findings are, where the field is going, in what direction. Reading, I would say it's not just limited to reading, it's also limited to the interactions and learning from each other. Not to, minimize the fact that reading is part of the job. So you have to carve out the time.
Lots of asking questions and reading and making sure you don't just read the headlines, just like some people might
Definitely. Definitely. And when a research study comes out, don't believe the media report. Go back and read the paper, because there are so many things like the assumptions that, researchers make.
Could you tell us how you got to where you are today with factors other than education?
I told you before that I grew up in South India, and one of the ways to get out of poverty and everything was actually a proper education. So education has actually played a very strong role. My parents were actually very supportive. So my father was not traditional with how girls were. Like, he treated me better. When I came here, I remember I did not know anything about the world other than what I had read about. And this was my first experience. So it was sort of like an adventure. I also found a way to kind of go back to school while I was working full time. And there were times when I had 2 and 3 jobs, 2 full-time jobs or 1 full-time job and 2 part-time jobs. So I guess the goal was there, like, what I wanted to achieve was always there. And just having certain people who believed in you that I could do it.
Yeah, it sounds like also you surrounded yourself by good people, and you had your father and some friends that were naturally supportive. But if some of our listeners don't have that support structure built in, to seek out people that raise you up, that praise you, and that make you challenge yourself and go beyond sort of your what you're comfortable with.
Just believe in yourself. There's a reason why you like or why you think that, there's a reason for your interest. Just push through with that and go with that. And, you will definitely find people, like-minded people, once you start working on that. So
awesome. None of these things happen on your own. It's always a great support network like you've built. And it's also great to hear that you've received a number of awards over your career, including the ANCC 2020 Certified Nurse Award in Adult Psychiatric Mental Health Nurse Practitioner category. And for our CareHero listeners who may not know, what does it take to achieve an award like this, and what does it personally mean to you?
I would not say that you should work towards getting an award, because that is not the right thing to do. You do what you believe in. You give it your all in all. So even if it is a mediocre thing or, something that doesn't, you do it the best way you can. I think that's the only thing I can say. The reason why I say that is because what I said, like knowing the right people and, so that is also built into the current, like, the merits and the awards that people get. I would say I'm lucky to get that award. The one thing I would say is whatever you do it in the best way possible.
So find a topic that you're interested in researching, you're interested in working on, and give it your 110%, and the good result will come.
110% is not mathematically possible, but
Dr. Xavier, you got me there. You got me there. And hey, on the topic of equity too, I mean, a lot of our listeners are women. My experience in academia, not too many women PIs and lead their own labs. And there's also probably, and you can confirm this, is not so many South Asian women or Black Indigenous people of color who get to the top, upper echelon of research. How would you tell somebody that's in those categories that are interested in getting to where you are today? What are some things that helped you along the way?
The first thing I would say is do not give up if things don't go the way that you hoped it would the first time around or even the second time around. Do not give up. If you got into a PhD program, if you want to get into a PhD program and you have all the, you have done all the work and you have done all the prerequisites, when you get selected, believe that you are qualified to be there. There are two things here. One is supporting folks, who want to actually do this. The other is the structural change that needs to happen. We do know that when we look around for STEM folks, or, there are a lot of programs that will actually say that we want to actually build a pipeline or pathway to improve, minoritized folks to get into, particular academic setting or something like that. What we don't hear about is we know folks are coming in. Now, how do we retain them? How do we support them so they can actually get there? So the work that needs to happen at this time right now needs to happen within the academic setting, like the structural change needs to happen. But to the folks who are interested in doing, it's like, do not give up. If you didn't make it the first time, doesn't mean that you are not good for it. It just means that things didn't work out your way. And having been in admission committees and some of the other things, I can tell you there are so many decisions that go into that process. So don't think that it's all you. Do not give up. Find out why you didn't get it the first time, and then address those problems, and then, do it again. But more than that, the systemic problems that currently exist, we need to actually work on that. And I don't think, it's up to the individual who wants to get into academia and run a lab. It shouldn't fall on that person's shoulders. We have to work as a system to kind of address those things.
Absolutely. It's being relentless is what I'm hearing from you and others that we've interviewed that have similar stories. Being relentless and not letting disappointments knock you down, because you need to work extra hard to break through those barriers.
Exactly. Failure is just part of the lifestyle, or, failure is part of the package in academic settings or in research. The emotional learning to kind of accept that and use that in your next step comes with practice. And that emotional resilience and that emotional learning usually happens in the first few years.
Dr. Xavier, you've shared some terrific learnings throughout your career here. But if you had to pick one item, what's the most important thing you've learned in your career?
Focusing on research, I would say how to ask the right questions. And this isn't coming from me because, people who are brilliant and, so Jonas Salk, the Salk polio vaccine. So he said that the answers pre-exist. What we need to do is actually learn how to ask them, because the way we are asking questions is limited by what we have access to, be it the tools or, the techniques or whatever it is. So that is the one thing that I wouldn't say that I'm an expert at it yet, but I'm getting better at it day by day. But that is what you need to learn how to ask the right questions.
That's very relevant. Not just research, but generally even to what we are doing ourselves here. So this is terrific. Thank you so much.
And Dr. Xavier, if you could do anything to improve healthcare in America, what would you do?
I would make mental health care the same as medical health care. So, when we talk about parity, it's not the same. People still struggle to find, access to mental health care, quality mental health care. We have a lot of crisis lines and everything, but to get an appointment to a specialty provider, it takes 3 months a minimum. And so if I had to do one thing, that's the thing that I would work on. Make sure that people who need mental health care have access to it.
Dr. Xavier, I totally understand your point about mental health access and how it's inequitable. And I hope they can make changes to this in the future. But relatedly, so say you get to travel to the future, what does the future of psychiatric nursing research look like to you?
So that's two questions. One is about the clinical side and one is about the research side, right? So the clinical side, anyone who needs, just tying back to what I said, I do firmly believe that people who need health, mental health care need to get it at the right time and at the right place. When talking about psychiatric nursing research, is that the work of, that there is more resources to actually support. And I think this actually ties back to the fact that we haven't invested enough in mental health. That kind of percolates itself to the research, side too. So a better future would be we have enough resources and we have enough people who are trained to actually do this type of research. And on top of it, that it's recognized. One of the things about nursing and nursing research is that there are many people who actually do solid work, but often nursing is not a discipline that is considered as a research specialty or a research discipline, and often the work that's done by people are overlooked. So people who do strong work are actually recognized as some of the other thing. I think that would make it fair and better.
Dr. Xavier, this has been such an enlightening conversation. Do you have any final thoughts or advice for our care heroes?
It's not an advice or a thought, but just saying that now people recognize the value of healthcare providers. We are a strong discipline. We are a strong group of like-minded people who want to actually improve people's, health and lives. Forgo the hero, name, and make sure that it happens all the time, not just during the pandemic or not just when people are talking about it. Let's give healthcare workers the resources, that we need to kind of provide better healthcare. Let's support them. That's the only thing I have to say.
What a nice episode with Dr. Xavier. Her positive energy just lights up a room.
I agree, Martin, and it's evident she loves her career and is so passionate about her work. Now it's time for the handover.
Alrighty, Care Heroes, here are our top takeaways from today's episode. Pursue what you love to do. Make each and every day meaningful and exciting to you. Remember that it's okay if you don't know everything. Face challenges head on and don't be afraid to reach out, ask questions, and collaborate with others to find solutions. Always stay thirsty for knowledge. Even if you only have time to catch up on it through social media, make efforts to expand your knowledge and expertise. And finally, believe in yourself and trust in your abilities. You don't need to be a genius to succeed. Persevere, don't give up, and be willing to push through the challenges until you ultimately reach success.
What a terrific handover. We also want to thank our care heroes for listening, and don't forget to rate our podcast on your favorite podcast app. If you want a shout out in a future episode, just visit careheropodcast.com. Go to the Contact Us page and submit your name, role, and location for a shout out in a future episode.
That's right, Care Heroes. Now it's time for some shout outs. We want to give a shout out to Moira, medical doctor from Los Angeles, California, Colby, pediatric ICU registered nurse from Cincinnati, Ohio, and Kelly, registered nurse from Portland, Oregon.
Okay, that's it for now. Thanks for joining us on the show, Care Heroes. We'll be back for the next one. Same Care Hero time, same Care Hero channel.
Thanks for listening to Care Hero Podcast. Don't miss out on future content. Hit subscribe and rate us in your favorite podcast app. Also, remember to visit us at careheropodcast.com to send us your feedback, sign up for the newsletter, and nominate a Care Hero to be interviewed on a future episode.